the Heart and Blood Pressure tutorial
by Gianni Taverna, Zoe Rapina, and Quinn Carlin.
This is the heart, one of the most important organs in the human body. Our deoxygenated blood flows through the heart into the superior vena cava and out into our lungs through the pulmonary artery. The oxygenated blood then comes back into the heart through the pulmonary vein and out to the body from the aorta. This is the superior vena cava. This is the right atrium. Then through the tricuspid valve, there is the right ventricle. This is the inferior vena cava and then the pulmonary valve. Blood then flows out the pulmonary artery. These are pulmonary veins, the left atrium, bicuspid valve, and aortic valve, into the aorta, and finally the left ventricle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. After counting to 15 seconds, I get a pulse of 21. To find your heart rate, you would then multiply that by 4 to make it a minute or 60 seconds. 21 times 4 equals 84, which means that is my heart rate. In this video, we will be showing you how to take a blood pressure. When taking someone's blood pressure, you need to make sure you pump it up until it's at 200. Once you get to 200, you'll turn the knob to the right, and then it will slowly release the pressure. Eventually, the meter will start to bounce slowly. That is a systolic pressure. Once it stops bouncing and slowly starts decreasing, that is diastolic pressure. In this clip, we see that her systolic blood pressure is at 110 and her diastolic blood pressure is at 50. That means her blood pressure is 110 over 50. What do you think the average systolic blood pressure is? Pause the video and think. If you said 120 or lower, you're correct.
This is the sheep's heart that we needed to dissect to figure out the pathway of deoxygenated and oxygenated blood. This is the front or anterior part of the heart. This is the back or posterior part of the heart. Are you taking video? We then needed to insert string to show the pathway of blood through the heart. The blue string represents the deoxygenated blood and the pathway into the superior vena cava and out of the pulmonary artery. The red string represents oxygenated blood and the pathway into the pulmonary vein and out of the aorta. This is the front of the heart, and this is the back.
The atrial septal defect is a condition where there is an opening in the wall between the right and left atrium. This causes oxygenated blood to flow into the right atrium where it mixes with deoxygenated blood. This increases the total amount of blood that flows toward the lungs and can damage blood vessels in the lungs. Sometimes it can be fixed with a patch over the hole. However, in serious cases, it requires open heart surgery.